my pleasure to introduce our host, Dr. Koji Hasegawa. Dr. Hasegawa is Director of the Division of Translational Research in the National Hospital Organization Kyoto Medical Center, and he's a clinical professor in the Faculty of Medicine in the Kyoto University in Japan. And Dr. Hasegawa will address the topic of the impact of smoking and psychological stress on cardiovascular health.
Thank you very much for your kind introduction, Professor Daniel Piniello. Today's my topic is smoking and psychological stress. And let's start with about how smoking will affect the pathophysiology of COVID-19. So the COVID-19 initially outbroke in December 2019, and as of February 13, the cumulative number of patients worldwide exceeds 100 million, more than fivefold compared with the 2020 last August. And the number of deaths exceeds 2 million, which is more than threefold compared with last August. And this is original data come from China. The overall mortality is 2.3%, but which is quite different from country to country and region to region. And more than 80% of patients are asymptomatic or mild symptoms, and 14% of patients exhibit a moderate level of symptoms, and 5% of patients exhibit severe symptoms and require intensive care and mechanical ventilation. It is unclear why that some of the people led to the severe state, but we know the risk factors for disease severity. These factors include advanced age, male sex, obesity, smoking, hypertension, diabetes, cardiovascular diseases, COPD, immunodeficiency, and cancer. And the cytokine storm and coagulopathy, as described by Professor George Zhang, these pathological states are the main, and these two states will cause massive pneumonia and pulmonary thrombus and myocardial injury, which finally led to the multiple organ failure and death in COVID-19. So smoking, tobacco smoke contains a number of toxic chemicals, and nicotine is one of the most important one. And nicotine is a potent vasoconstrictor and causes thrombus formation. And a number of toxic chemicals also cause oxidative stress and induce inflammation of blood vessels, and which finally led to the development of myocardial and cerebral infarction. So possibly smoking will increase the thrombogenicity in COVID-19. Let's see the relationship between the smoking history and the COVID-19 severity. This paper differentiates patients into non-smokers, past smokers, and current smokers, and compare the rate of disease progression to ICU admission and mechanical ventilation. The rate of disease progression was highest among past smokers at 24%, followed by current smokers at 12%, and the non-smokers was low, less than 5%. So past smokers are often elderly and associated with cardiovascular and pulmonary comorbidity. So that may be the reason why the past smokers was the highest rate of disease progression by simple comparison. Let's see the comparison of current smokers versus past plus non-smoking. And current smoking is a significant risk factor of disease progression. This is a systemic literature review and meta-analysis. The odds ratio of current smoking was 2.04. This was clearly significant. Then what will happen if we include both current smoking and past smoking? the presence of smoking history may be the largest contributor to disease progression. The analysis of factors associated with disease outcomes in hospitalized patients with COVID-19 demonstrate that odds ratio for the presence of smoking history, if we include both current and past, was 14. Although the CI was large and the number of patient study was small, the result may be useful as an estimate for the impact of smoking history. So advanced age and smoking, if we include both past and present, these two are the strong background risk factor, and these two background risk factors will lead to the development of cardiovascular disease, COPD, and cancer. And these disease states are associated with reduced cardiac and pulmonary function and immunocompromised state, and finally led to the development of severe states and death in COVID-19. So the mortality and infection rate are quite different. And the right side is a mortality in more than 80 years old. The mortality is 12%, but infection rate, the more popular among younger generation, 20s and 30s. And on the other hand, the mortality is almost zero in population less than 30 years old. So there are several papers showing that SARS coronavirus 2 PCR positive ratio is low in current smokers compared with non-smokers. But this is far away to conclude that smoking inhibits infection because the smokers receive more PCR examination because of cough symptoms. And tobacco smoke contains a number of chemicals attached to the respiratory tract and increases false negative results. And the scientific brief by WHO says smoking is associated with increased severity of disease and death in hospitalized COVID-19 patients. No evidence to quantify the risk on smokers of infection by SARS coronavirus 2. So the psychological stress is very important. In case of Japan, suicide continued to increase after July 2020, and 40% increase in October 2020 compared with the same month in 2019. The increase predominated among women compared with men, and the proportion of people in distress ranging from 35 to 60 all over the world. And warning from the United Nations says a mental health crisis concerns over an increase in suicide, and estimated prevalence of depressive symptoms is threefold increase compared to the rate prior to the outbreak. So the WHO made a consensus statement on COVID-19 as a need for action on mental health. To cope with stress, people are turning to bad habits such as alcohol, drugs, cigarettes, and online game. And this is a paper of the current smokers. Actually, the current smokers are going two directions. And 25% of current smokers increased their tobacco smoke number of pieces per day. This may be due to the anxiety, psychological stress, and depressive mood. On the other hand, 20% of smokers decreased their tobacco smoke. This may be due to the threat by COVID-19 to develop severe symptoms. So if we could more stress that COVID, smoking as a risk factor in COVID-19, we may be able to increase the number of smokers trying to quit smoking. And tobacco smoke contains a number of chemicals, and nicotine is a major component, and nicotine will get into the bloodstream and then bind to the receptor in the brain and release noradrenaline, dopamine, and serotonin. And serotonin possesses antidepressive and anti-anxietic actions. So the smokers temporarily feel pleasant feeling and can get out of depression and anxiety. But this is just a temporary relief. If smokers continue smoking, these neurotransmitters will not come out without nicotine. That is a nicotine dependency. So psychological stress or depressive state and smoking and nicotine dependency are closely related with each other. There are so many factors of psychological stress during COVID-19 pandemic: fear of infection and anxiety, staying home, lack of exercise, decreased opportunity of meeting and communication, economic collapse. These will lead to psychological stress, and smoking are closely related with psychological stress, and these two factors synergistically increase cardiovascular diseases. So the impact of COVID-19 related depression is great. We need a maximal effort to prevent cardiovascular diseases by improving mental health and lifestyle during and after COVID-19 pandemic. And thank you very much for your attention.
Thank you so much, Dr. Hasegawa, for your excellent presentation. We enjoyed very much. We'll be back with you with some questions when we finish.